And we're joined now in the studio by co-founder of UsForThem, Molly Kingsley. Morning, Molly. If it wasn't for you, there would be no frame of reference for children on this COVID inquiry. Just explain to people, first of all, what that means.
Yeah, I mean, I think it's just one of the many problems that is becoming apparent with this inquiry. So when the original terms of reference for the inquiry were announced almost a year and a half, 2 years ago now, they had mentioned education, but very narrowly. They did not include the word children. So you have this idea that you have this cohort of, 10 million little people that were going to be entirely excluded from the inquiry, other than through the impact on schooling, which, is a big part of children's lives, but it's not the only thing that went wrong with children in the pandemic.
How could that have even been considered as an option?
Not enough parents in the decision-making process.
But was that down to Baroness Hallett, who's chairing the inquiry, or I can't work out who was thinking that was legitimate?
I think it's indicative of a really core failing throughout government governance processes. No one is thinking about vulnerable people and children. And in fact, there was a really, really interesting statement from Cummings yesterday on just that point that hasn't been picked up. And actually, it's so interesting. I wrote it down. And what he said was that he was asked directly by the KC, who was thinking about the impact of lockdown, not of COVID, but the impact of lockdown on the most vulnerable. Yeah. And Cummings answered, and this is a quote.
And just to be clear, so what he meant by that was the lockdown impacts on abused wives, children in care, people locked at home who needed extra help.
Exactly. So on this cohort, he didn't actually mention children, the case, but he meant the people who were going to be most impacted through lockdown. And what Cummings said, and I thought this just speaks to so many of the issues, he said almost that whole aspect was almost entirely appallingly neglected by the entire planning system.
So nobody in that whole operation, Number 10 has 140 odd people rattling around in there, thought about?
No, there wasn't a plan. He said that. There wasn't even a plan to make a plan. And to answer your question about, what happened with the kids, well, there wasn't a plan. No one was thinking about the kids. And, actually, we know it goes much beyond that. No one was thinking about the harms of lockdown.
Mental health and the failure of education.
The economic cost. I mean, it's just...
And we've got Helen McNamara that we're seeing here. So she is the British former civil servant. She served as Deputy Cabinet Secretary in the Cabinet Office when all of this was going on.
She's the most senior woman in Number 10.
What do you want her to say, Molly? Or in fact, maybe let me turn that differently. What do you want her to be asked? Because the frustration for me is the questions are awful.
Yeah, the questions are not really cutting through. And it was very interesting, actually, when Cummings said that yesterday, which was a very big revelation, even if we all suspected it, to hear it. And he wasn't questioned about it. The KC moved on, and the next question was about the impact of long COVID. And you just think, there's this disconnect.
Hang on, yeah.
But to answer your question, I mean, I think she has to be asked about the governance processes, the decision-making. Were costs balanced against benefits? And if not, why not?
And I know that I've read some of the stuff that she said that the women in Number 10 were just shouted down by the men, presumably Dominic Cummings being one of them, who says he's not a misogynist, despite we know what he called her in a tweet, which I would never call a woman.
No. I mean, he said he called the men worse, didn't he? But I mean, it's still
so that's okay,
that was his defence.
But interesting that women who've got a big argument in this, because women are always in charge of childcare, or normally, aren't they? They were drowned out by the men.
And I think that's, that from the very beginning, it was a very myopic response that in particular was terrible for children and families. I mean, it just was.
Just one last point. The most chilling bit for me yesterday was where they both agreed, Cummings and Hugo Keith, that what the country needed was a test and trace and isolate system, because then we would have all been okay. What does he mean by that, Molly?
Yeah, I mean, I think this is the most worrying thing about the inquiry. They have a preferred storyline, and their preferred storyline is we should have more interventions, we should have locked down sooner, harder, we should have a big test and trace diagnostic system. Now, that may or may not be a valid line, but we should be questioning it, we should be challenging it. And we know trust and trace was a £37 billion waste of money.
Completely.
Why would we have more of it? It's insane.
But you know why? Because out of every crisis of every government throughout history comes more control of individual people.
And also, it's follow my leader. If they did it somewhere else, we better do the same. Otherwise, you'll be criticised.
I think that you've hit the nail on the head. There is a chronic and I think quite criminal lack of leadership here. Where are the leaders? Where is the accountability? There is none.
If it had come to us first, maybe we might have done things differently.
And if Boris had stuck to his instincts, and I know he's been badly painted, I think that's very unfair.
I think it's very unfair.
And they saw all the problems with the health service in Italy at crisis point. People were dying in corridors, and that's what panicked them.
And we know that a lot of that information coming through the media, you know, we know it was exaggerated. We know in some cases the images were fake. I mean, it's incredible that we based a pandemic response on this.
On Chinese propaganda, which previously we would have ignored. Molly, lovely to see you. Thank you so much.